Well, Naledi, we've been trying to get to as many hospitals as possible. We know that Helen Joseph Hospital, one of the hospitals that we're visiting this morning, there has been a dire shortage of water, but the Gauteng Department of Health has tried to intervene by sending water tankers to come and fill some of the tanks at these particular hospitals. You'll see here right in front of me is at the Helen Joseph Hospital at the Renal Dialysis Center, which is one of the critical areas that needs water. That is being filled at the moment with a couple of thousands of litres of water to ensure that this really does not turn into a crisis. You would know, of course, that Johannesburg Water had indicated when it sent out its statement yesterday that there would be the restrictions that would be experienced. And as a result, what we're seeing is that there are a number of suburbs that have been affected and a number of hospitals as well. I want to bring in the spokesperson for the Gauteng Health Department, Mutale, who joins me now. Mutale, thanks indeed for your time this morning. 36 health facilities that you're looking after in this particular province. Which ones are of concern at this time?
It's actually 38, but we've got 3 which are of a major concern at the moment, because that's where now we're feeling the pressure in that there is currently isn't any water there. What is happening is that we have engaged with both the city of Joburg through Joburg Water and the Ekurhuleni Metropolitan Municipality. We've got 2 hospitals, Rahima Musa, Mother and Child. We also have Helen Joseph, which are both in the city of Joburg, which are currently being supplied water using water tankers. We also now have Pulsong Hospital, which is in the Ekurhuleni area, which is also now the municipality will be supplying them with water through their through water tankers. So obviously we are because these are healthcare facilities, water becomes critical for both clinical and non-clinical services.
And I think of concern is the critical procedures that these hospitals conduct. I do understand that there is a decision to move or to postpone some of the non-critical surgeries as a result of this water crisis.
Well, Chriselda, those kind of decisions are decisions that are actually made by clinicians on the ground who are at facilities. You know that when it comes to patient care, clinicians have a greater say, they have the last say in terms of what should happen. And what is currently happening now is that as the situation evolves and they make an assessment on the ground, the clinicians across all these facilities that are affected are having to take decisions in terms of prioritizing those procedures that are of an emergency in nature, but those that what we call your elective procedures that could maybe be moved to a later date, they are having to maybe make assessments to make those kind of decisions so that we don't compromise those that require us to be able to provide services. So it's quite important that we make a call as well to our communities that those that need care, that they first start at our primary healthcare facilities or our clinics so that they can be assessed there, because some of the people that come to facilities like this, when you come to a hospital, it's because you require a higher level of care. But across our communities, we've got clinics, we've got primary healthcare facilities that can still provide services to communities, so that when people come to hospitals, it's because they have been referred for higher care.
How sustainable is this, though? I think this is another water tanker that's being brought in. Let me just ask my colleague Kina now to have a look at that. That is a water tanker, right? Yes. A second one that's being brought in at this time to alleviate, Naledi, the pressure at these facilities. I mean, a healthcare facility, and especially because, we just come from an area of COVID. The message is always wash your hands after you come from the bathroom. We need water for everything. So there's really been a great concern at this particular point that to the added woes of load shedding as well, where some of these, machinery will need electricity to pump some of this water. It really seems to be a challenge at this particular point. So Helen Joseph being one of those facilities that is really under pressure at this particular point, but alleviation of that in terms of these water tankers that have been brought in to fill up these tanks. You were saying, Mutale, that this is a 8,000 litres of water that is being brought into a 10,000 tanker. Is that correct?
Yes, it's 8,000 litres from one of the trucks there, and is being pumped into a 10,000.
We see another truck coming in as we chat. I'll ask my colleague to have a look at that.
Yeah.
They can continue. There's 3 trucks coming through right there. So I'll ask my colleague here now to focus on that while we speak to Mutale.
So yes, the tankers are coming consistently throughout to ensure that there's consistent supply of water in the critical parts of the hospital, and the same is happening in the other facilities that are currently affected.
All right. Mutale, how sustainable is this though? I think everyone would ask, how sustainable is it to get critical water to all these areas on time? Because I guess now it's not just hospitals, but communities also, which we'll be visiting very shortly, which you don't speak on behalf of course. But how sustainable is it to get adequate water to these facilities on time?
Look, it is critical that there is constant supply of water to the healthcare facilities so that we can sustain the quality of services that are being provided to communities. In terms of the current situation, of course, we're hoping that the relevant authorities that have the responsibility to ensure that there is a supply of water to everyone, that they are working around the clock to ensure that as speedily as possible they are able to sustain this, because of course we don't want a situation where now you've got many other facilities that are facing the same situation, because it's not going to be sustainable, because it means you'll need to have multiple water tankers, all of them at the same time consistently feeding our various facilities. So we're just really hoping that the situation would be addressed as quickly as possible to ensure that services can actually continue as normal.
Mutale, thank you very much indeed. We do appreciate your time. The spokesperson for the health department telling us that of those 38 facilities that the province does look after, their concern is 3 of those facilities at this time, being Rahima Musa, not too far from where I am, Pulusong, as well as the Helen Joseph Hospital. That's where we're broadcasting from this morning. A number of water tankers have been brought in, and I must tell you, Naledi, from this point we'll be moving into various communities that have called us to come and show us how they're dealing with the situation at this particular time. Others saying that they're running businesses from home, they're unable to do anything. It is quite a dire situation, and many are hoping that a solution will be found to it as speedily as possible. But we thought we'd start here at these facilities to get a sense of exactly what the impact of these water restrictions are. And straight after this, we'll be going into a number of communities where they say the situation there is equally dire.